Hello, my name is Joel Dunn and I'm a physiotherapist.
Hello, my name is Sam Forrester and I am an occupational therapist.
Hello, my name is Helen Barnes and I'm a registered nurse.
My name is Ben Donald and I'm a therapy assistant practitioner.
Hello, my name is Valentina Canio and I'm a care practitioner.
And my name is Hina Tariq and I'm a physiotherapist and researcher working in the field of contracture prevention and management. This video session aims to help you understand what contractures are, how to recognize them, and what steps you can take to help prevent contractures developing and worsening.
Contractures can be described as a loss of movement in a joint which can occur due to shortening of the muscles or other connective tissues such as tendons, ligaments, joint capsules and skin. Contractures develop when normal elastic connective tissue is replaced by stiff, fibrous tissue. This can lead to difficulty bending or straightening a joint. Contractures can impact on a person's whole posture or be specific to a particular joint.
Contractures develop over time, often starting as a mild contracture, which may not be painful or impact on a person's ability to perform tasks such as eating, drinking, dressing, transferring or walking. But it will likely progress over time to become a moderate or severe contracture. Once at these stages, it is not reversible, so the key is early identification and preventative approaches.
You might also observe people in your care experiencing pain or discomfort as a consequence of having a contracture. Changes in a person's posture due to contractures can put them at risk of developing pressure sores. Contractures cause difficulties in activities of daily living, such as eating, dressing or washing, therefore increasing their care needs. If contractures affect a person's ability to walk, it puts them at an increased risk of falls. Moving and transferring can become difficult and could lead to a person spending more time in bed. This in turn has a negative impact on sitting up to eat, engaging in social activities and can worsen their posture.
Contractures have a significant impact on you and your colleagues, such as increased burden of care as people become more dependent for simple tasks like repositioning in a bed or support to eat and drink. Increased need for equipment and difficulty in moving and handling tasks as the person becomes stiffer and the body is more painful to move. You may start to notice that your workload becomes more physically demanding, and it can be difficult watching someone under your care begin to deteriorate.
Contracture development is a vicious cycle. Limbs that are placed in a poor position and not move for long periods will cause structural changes within the muscle. This fibrotic change leads to joints becoming stiff and deconditioned. Contractures can cause pain and increase the risk of pressure sores or skin breakdown, all contributing to the joints or body being moved less. You may see a reduction in how a person moves around, eats or drinks, or undertakes daily care activities. The person becomes less active and weaker over time, making them more reliant on others. This in turn can affect their motivation to engage and can impact their overall quality of life. Contractions worsen as the joints and muscles are not moved for long periods, therefore completing the cycle.
Contractures are common in neurological condition. You may see this in your residents with a history of stroke, traumatic brain injury, spinal cord injury, multiple sclerosis, cerebral palsy, dementia or Alzheimer's disease.
If your residents become less mobile or spend considerable time in bed, this will increase their risk of developing a contracture. Contractures can also develop after burns or traumatic injury.
According to research evidence, there are certain risk factors that may cause a contracture to develop. Consider these as early warning signs to watch out for with your residents. 1. Reduced functional ability. You may see this when a person in your care starts needing increased support to complete everyday tasks.
2. Reduced physical mobility. You might observe this as someone having increased difficulty getting on and off the bed or toilet, or changes in how mobile they are.
3. Pain. You may notice that a person in pain does not move as much as they normally would do. You may also see that they hold their limbs in a particular way to avoid pain or adopt a curled position when in bed. All of these can have negative effects on the joints and muscles, increasing the person's risk of developing contractures.
4. Muscle weakness. As we age, our muscles naturally become weaker and people often become less active. The less we use our muscles, the weaker they become. This can be worsened by medical issues such as frailty or when there is a neurological weakness such as stroke, Parkinson's or MS.
5. Impaired cognition. Someone experiencing impaired cognition may simply forget to move or reposition themselves frequently enough. You may also observe that it becomes harder for them to engage in tasks, further reducing their activity levels.
6. Pressure sores. These are concerning because they often mean more time will be spent in bed in one position. Not changing position frequently can increase the risk of a contracture developing. Pressure sores can also take considerable time to heal and therefore restrict a person's ability to remain active.
7. Reduce motivation and mood change. When people experience mood change, they can become less motivated to participate in physical and social activities, contributing to them being less active.
For contracture prevention, we have created a Let's Stop Contractures campaign. The acronym STOP stands for Strength, Treatment, Opportunity to Engage and Positioning.
S stands for strength, trying to support and encourage the individual to exercise, which will help maintain and possibly even increase their muscle strength. Strength can be maintained by performing physical activities or undertaking an exercise program. You can get information on beginning a strength and exercise program from the Stronger My Way campaign provided by the Chartered Society of Physiotherapy. You can Google Stronger My Way to find the resources available. Their website has helpful resources and suggestions to help people maintain or improve their muscle strength.
T stands for treatment. By encouraging good fluid and food intake and treating pain with prescribed medications, you can treat dehydration, malnutrition and discomfort, which all contribute to contractures developing or worsening.
O stands for opportunity to engage. Continue to encourage the people you support to move at regular intervals and join in with meaningful activities. This can help lift their mood and encourage them to remain motivated. Public Health England and the Think Active charity have free resources for you to use to promote home-based physical activities or exercise.
P stands for positioning. Positioning is the most important aspect, as how we spend our time sat or in bed has a dramatic impact on our posture. We need to consider how a person's posture is supported throughout a 24-hour period.
Pillows are an inexpensive and effective way to help manage someone's posture. Try to imagine how you would like your joints to be positioned if they were uncomfortable and use extra pillows for support.
If someone has a limb that is sore or stiff, consider putting a pillow underneath it to give support and allow them to rest more comfortably. For more specialist contracture or postural management care plans, consider a referral to physiotherapy or occupational therapy.
In addition to STOP strategies, we recommend regularly assessing and monitoring the risk of contractures. A risk assessment tool called Oracle is currently under development in a collaboration between Bournemouth University and Dorset Healthcare. We will continue to update you as this progresses, and further training will be provided.
We are aiming to improve the early identification of contractures through the use of the Oracle tool. However, prevention is essential and you play a key role. We hope that this session has given you a greater understanding of how contractures develop and what you can do to help prevent them occurring and support the people you care for. Please think STOP as part of the Let's Stop Contractures campaign. S for strength, T for treatment, O for opportunity to engage, and P for positioning. Thank you.